Hi, I'm Carla from Fertility Network UK. I'm the England coordinator. And this evening we're doing an all England information session. And we've got Olivia, the general manager from Access Fertility, who's going to give us a short presentation about the service that they offer and hopefully be able to make your IVF treatment a bit more affordable and the options that they have available as well. So if I hand over to Olivia.
Thanks very much, Carla. Hi, everyone. As Carla said, my name's Olivia and I work for Access Fertility. Thanks very much for taking the time out of your evening this evening to hopefully learn a little bit more about what we do and basically how we can hopefully help you pay for your IVF treatment. So first of all, I'm going to talk a little bit about our programs and kind of how we can use those programs to help you reduce the financial risk of IVF treatment. So the first program you'll see here on the left is our refund program. So in terms of what this program offers, it offers up to 3 cycles of IVF or ICSI. And when we talk about cycles, we talk about egg collections. So up to 2 or 3 egg collections the programs would offer depending on which one you choose. And then a key benefit of our program is we do include unlimited frozen embryo transfers. So as many embryos you create under the program, you can transfer those back, included in the cost of the program. So no extra costs included. And then if you do reach the end of the treatment program, so you've had all of the fresh cycles, so all of the egg collections, you've transferred any embryos that you've created under the program, and unfortunately you haven't had a baby by the end of the program, that's when you would receive the refund. So up to 100%. The reason we say up to 100% is because we do offer different refund options. So we offer a 50% option, a 70% option, and 100% option. And the reason we offer those is to tailor to different patient needs. The lower the refund amount, the lower the initial cost of that program. And it's up to you which option you'd like to choose. In terms of who the programs are available to, the refund program is available for patients under the age of 40 using their own eggs. We do also have egg donation options available for women under the age of 55 using donated eggs, and these are available at a selection of clinics that we work with across the UK. The refund program is subject to a medical review. We do have around a 90% acceptance rate. So, we want to accept as many patients as we can onto this program. And you may be thinking, what does the medical review entail? So when you go through an IVF cycle, you'll go into the clinic, you'll have some initial screening, and then the clinic will advise the best treatment for you, the best IVF treatment for you. So what we'd do at Access Fertility would just review those notes and then we'd let you know if you were eligible for that refund program. Okay, so the next program is the multi-cycle program. So a fairly similar program, but the main difference is there's no refund element with this program. So it's more of a cost-saving program, if you like. So you're paying for multiple cycles up front, discounted over a number of cycles. So what it includes is up to 4 fresh cycles. And the reason we say up to 4 is there's different options. So a 2 egg collection option, a 3 egg collection option, and a 4 egg collection option. Again, we want to offer as many options to patients so that you can pick the most suitable program for your needs, for your treatment needs. The program, again, includes unlimited frozen embryo transfers. So the same as the refund program, as many embryos as you can create, you would transfer those back under the program at no additional cost. And if you have looked at kind of IVF costings at all, you'll see that that is a significant benefit, having unlimited and not having to worry about paying for each individual transfer. So in terms of age for this program is available for women under the age of 45 using their own eggs. And it's also just worth noting, if unfortunately you're not able to use the refund program, because unfortunately you are ineligible for the refund program, you of course still have this option. So this is very much available for any patient under the age of 45 that has been recommended IVF treatment by your clinic. So there's also no medical review because there's no refund element. So this program is very quick and easy to apply for as well. Okay, so that's the programs themselves. Now you may be wondering, okay, you offer these programs, how am I going to pay for those programs? And that's a very key factor when looking into IVF treatment. So Access Fertility offers two payment options or two options to pay for our programs. So one is paying up front, so that would be the full program fee. So to cover all of the cycles, a lump sum up front. And then the other option would be our finance options. And we don't mind how you pay, it's up to you. We just give you the options, so either upfront or the payment options, which I'm going to talk about now. Okay, so the Access Fertility Finance Solutions. So we offer finance solutions for patients looking to spread the costs of any of our programs. So what our finance allows you to do is borrow up to £12,000. You can use it to pay for all or part of your program fee. So let's say, for example, you had some savings, you wanted to put that towards treatment. You could do that, and then you could pay, let's say, the other half monthly over 12 months at 0% interest. So it is key that I mentioned that the loan is 0% interest. You pay it back monthly over 12 months. Okay, so just to summarize now, really, so the key benefits for using the Access Fertility programs and finance. So the first one is you're fixing your treatment fees. So one of the biggest things when the company was founded is that we realized that IVF is a minefield in terms of treatment costs. You may see an upfront cost and then various add-ons will be put on. And then the next thing you know, you're paying a lot more than you had initially thought. So what Access Fertility tried to do is fix that cost. We include the add-ons. So for example, at some clinics, we include things like the time lapse, blastocyst culture, and years freezing and storage. So, and then also when we're paying for multiple cycles, when you've taken out a treatment program, you then don't need to think about, okay, how are we going to pay for the next frozen transfer? How are we going to pay for the next cycle? If we do need it, you've basically got that backup plan and you've got a fixed cost that you know upfront. So basically, this will hopefully help you save on the overall cost of treatment because our programs are discounted over a number of cycles. Up to 100% refund. So if you are on the refund program and unfortunately your treatment doesn't work out, then you would receive the refund of the program that you signed up to. When we say enhancing choice, it's really about giving you options to pay for your treatment. So you may still find that you, let's say you want to pay the clinic directly, you want to take a program without finance, or you would like to explore the finance options. It just means that you have different options available to you and you can find the best program or the best treatment to suit your individual needs. And then finally, spreading the cost of your treatment over a number of months. So unfortunately, IVF treatment is not low cost. So spreading the cost of treatment may be able to make it more palatable if you can spread it over that 12-month period and pay it back monthly. Okay, thank you very much, everyone, for listening. Carla, I believe we're going to move into some questions now.
Yeah, thank you, Olivia, for that overview of what you do. And then I've just got a couple of questions which might be helpful for
Absolutely.
people. Is
Yeah.
just wondering for the refund package, how long? No, sorry, the refund package. What
Yeah.
would Access Facility need for that medical review, and how long approximately does that take?
Yeah, very good question. So we would only ask for the basically information that you'd have from your initial consultation. So, for example, you have an AMH test, you'll have an antral count scan, and also a semen analysis as a kind of basic tests. So we'd require that information. We don't need you to give it to us. Basically, you'll sign a consent with us, and then we can just request that information directly from your clinic. So you don't need to worry about it. All you need to worry about is they've got the tests and they will send them across. But it will be the standard screening tests that you'll have before treatment. In terms of the time frame, so we do allow up to 2 weeks for that medical review. So very important to factor that into, if you know you're looking to start treatment imminently, that you do factor that time frame in. Typically, we do get back to patients quicker than 2 weeks, but we just allow that time frame unless we do need to, in case we do need to ask any questions or for any additional information from the clinic. For example, we would need, if you've had any treatment before, we'd also need to know, to see any of the notes that you have from your previous cycles. Also, it's worth noting if you are applying for finance, we'd also recommend that you apply for finance at the same time and then allow the 2-week window for that as well. So you kind of run those applications together. And just to confirm, they're not linked at all. The medical review is completely separate and the finance application is completely separate, but we just like to get them in place so that, we're not going to be delaying treatment at all.
Yeah, so they actually take a similar amount of time. So by the time you
Correct.
do the medical review, yeah, your finances
Yeah.
in place if that's what you want.
Yeah, exactly right.
Yeah, thank you. Um, I did write one down as well. Another question for you. Um, how long does it take then from, say, if you went for a multi-cycle, how long does it take from saying, yes, I'd like to do that package to putting everything in place, and what do you have to do?
Yeah, so I think, to be honest, for all programs, we'd always say allow as much time as possible. So kind of as soon as you know you're going to go ahead with treatment, we'd recommend giving us a call, getting some information. You can talk to our team. They can talk you through all of the steps, all of the inclusions, specifically at your clinic, and then all of the pricing and everything, again, directly to your clinic. So we'd always allow at least 2 weeks, so minimum. But with the multi-cycle, it is slightly quicker because there is no medical review. So, we can turn it around within a couple of days if necessary. But again, we'd always advise, allow as much time as possible, just to make sure that you have got everything in place. Because again, we don't want to be delaying the start of your cycle, and we do need to authorize the treatment with the clinic before you can actually start.
Yeah, and then as part of treatment, do you have if somebody was using donor sperm, can they still access the different packages?
Yeah, absolutely. Very good question. So yes, that's no problem. Patients can use donor sperm, and then that would be kind of sourced directly through the clinic or wherever you're sourcing your donor sperm from, but again, would be dealt with in the clinic, but we have no problem with that at all. It would be taken into consideration when doing the medical review, but if you are using donor sperm, then obviously it's going to be good quality, so that's absolutely fine. That's no problem. The only thing to kind of bear in mind is that the actual cost of the donor sperm wouldn't be included in the program fee. So that would need to be paid directly to wherever you're sourcing your donor sperm from.
Yeah. And then leading on to that is I believe that Access Fertility does do one package for if you're using donor eggs. Is that right?
Right. Yeah, absolutely. So I covered that off with the refund packages. We also offer a refund donor egg program. So it works in exactly the same way. So up to 2 or 3 cycles. The difference is you would obviously be using donated eggs. And then depending on the clinic that you're using, they would either be frozen or fresh eggs. So they would either be from a bank or you'd be matched up with a donor to have to receive fresh donor eggs. And then it would be 2 or 3 cycles, and then and unlimited frozen transfers. And then if you did unfortunately reach the end and you weren't successful, you could then receive the refund depending on which program you've signed up for.
I
And
assume
that,
that.
oh, sorry, I was just going to say that's available for patients under the age of 55. The age does vary slightly depending on which clinic you're at, so it's just worth double checking that with your clinic if you are looking to go ahead with donor egg treatment.
So for donor egg treatment and for which clinics that package is available with, is that limited to which clinics will do it?
Yeah, so we offer it across the country, but it is limited. So we offer it with clinics in London. We have a clinic in Manchester and also Wales. So Cardiff, Manchester Fertility, our care fertility clinics we offer it with, the London Women's Clinic in London, and Wales, sorry, and then also CRGH in London. So I'd say the main, like the most options available would be in London, and then outside of London, Manchester and Wales.
Okay.
Oh, I'm sorry, Bristol as well.
Oh, another one.
Yeah, Bristol, BCRM Bristol. Apologies, that's a recent addition. So BCRM Bristol, we do also offer egg donation.
Yeah. Okay. If I just have a look in the chat, I think there's some questions as well, and then I'll open it up to
Great.
everybody. Yeah, that's quite a valid question. So I've got one in here. Does Access Fertility work with clinics abroad? And if so, I can't see because it's down the way. Hang on a minute. I just moved. That's not very good, is it? I've just moved my mouse. Yeah,
Mhm.
does Access Fertility work with clinics abroad? And if so, how does that work?
Yeah, so we do work with clinics abroad. So we have clinics in Portugal, Spain, I guess Ireland would count. Um, and we offer basically the same programs. So if you were interested in treatment abroad, I would suggest calling in and then asking our team for more information. If you have a particular country in mind, so let's say if you were looking at Spain, for example, if you just let our team know that, and then we can give you information of the treatment programs that we offer there. But yeah, it would be the same refund, multi-cycle, donor egg as well.
Thank you. Um, Another question, can we use the multi-cycle program but not undertake fresh cycles in order to genetically test embryos but transfer the tested frozen embryos?
Yeah, absolutely. So we would class that as a freeze-all cycle. So you'd go through the egg collection, you wouldn't have a fresh transfer, and you would just store those embryos, test them, and then when the embryos come back, the embryos that are viable, we then just ask you transfer those back before the next egg collection. So the only thing to make clear here is you must use any embryos you have from an egg collection before you move on to the next egg collection. So you wouldn't, for example, be able to do, let's say, all 3 egg collections and then transfer the embryos at a later date. We would just require that you use those embryos before you move on to the next cycle. It's also just worth noting that if you are having genetic testing, absolutely fine, compatible with the program, but you would need to pay the cost of that genetic testing directly to the clinic. But of course, the IVF services, so the egg collection and the transfers, would be covered by your program.
And I assume it's the same if you wanted to do a freeze-all cycle for whatever reason, obviously you can get overstimulated or just by choice, but then you could
Exactly.
have a transfer
Mhm.
later on in the program.
Exactly right. Yeah. So you would just store those embryos, and then when you were ready to come through for the frozen transfer, you would come through for that, and that would be covered by the program.
Okay. Um, Somebody's just said, are there any longer finance options? What's the maximum duration?
Yeah, so the maximum duration on the Access Fertility is 12 months. So we only offer 0% 12 months, and that doesn't translate at a later date. To extend it, you do have to pay that off within the 12 months, 0%. We do work with an external finance provider, and they would offer longer loan terms, but that is interest bearing. So unfortunately, the 0% is only for the 12 months. But if you were looking for interest bearing loans, you can give us a call to find out kind of more information about that.
Okay, and can you partially finance some of the program? So on the interest free, could you partially put some of it on interest free and then pay the rest yourself, like upfront yourself?
Yeah, absolutely. So let's say, for example, your program was £8,000. You could pay 4,000 up front, and then you could take a loan out for 4,000 and pay that back monthly over 12 months at 0% interest. That's
Yeah.
not a problem at all. And also just kind of linked to that, it's also worth noting that there's no penalty for early repayment. So let's say you've got 3 months in and you decided actually we want to pay off the loan. There's no penalty for doing that. You can absolutely do that, and you can still continue with treatment.
Okay. I'm just reading this next question before I read it out.
Yeah.
Okay. On a multi-cycle plan, if you start your plan at age 44 and do one cycle, but then turn 45 at the point where you might do your second or third cycles, are you still able to apply? And then the next question is, would you need to pay for the total cost of the entire plan before you're 45?
Yeah. So our kind of age is for the age that you are on the day you enroll. So let's say, for example, if we're talking about a multi-cycle program, if I'm turning 45 tomorrow, as long as I pay today, I can still continue in the program. The only thing I'd highlight is it's worth just double checking with your clinic that they're able to treat you over the age of 45 as well. But yeah, absolutely, all of our programs. Yeah, if you pay, we're never gonna, and you're enrolled on the program, we're not going to suddenly pull you off because you've gone above the age bracket.
In terms of going back to the refund package now, this question, is there a minimum AMH and sperm parameters to be accepted on the refund program?
So all of our well, for the refund program, sorry, we have an in-house medical team that would review all of your medical notes. So we don't have a set criteria. So if you do want to find out if you're eligible, you would need to apply. To give a rough idea, if a patient, let's say, for example, AMH under 5, they are more unlikely to be eligible for the program. As I'm not medically trained, I don't want to go into all the exact criteria, but our application is free of charge. So if you did want to apply and then for whatever reason you didn't want to go ahead, again, we wouldn't charge you anything. You can just call us up, apply and see, and then it's up to you if you want to go ahead.
Okay. Does the program start once you've had a live birth? If you want to try for a subsequent child, do you need to pay for another program?
Yeah, good question. So with our programs, the slight risk element, or I guess you'd say maybe the catch element, is if you do have a baby at any point in the program, that is the end of the treatment program. So if you use all treatment and unfortunately reach the end, you haven't been successful, you would receive the refunds. But if you do have a baby at any point, that program comes to an end. If you do have any embryos, however, in storage, Access Fertility has absolutely no ownership of those. They are your embryos, but you would need to pay the cost directly to the clinic to transfer those embryos at a later date.
Just having a look, see what other questions we've got. It's a good question. I will bring it. Like I say, I know the answer. If we go for the refund package and you have a baby after 2 cycles, what percentage is refunded? But if you have a live birth, obviously you've just said the package comes to an end.
Yeah, exactly right. So if you have a baby at any point during the program, that is the end of the treatment program. So it would only be if you reach the end of the program and unfortunately you haven't been successful that you would receive the refunds.
Okay. Going back to finance, what is the interest rate increase to after the 12-month 0% interest rate expires?
So it will not be increased because you have to pay it off within a year. So we wouldn't move you on to another interest bearing. The loan is 0%. It has to be paid off within 12 months. So let's say, for example, I took a loan out for £12,000. I pay it off within 12 months. That would mean I would have to pay off £1,000 each month. And I wouldn't be able to extend that over a year. It has to be paid off within the year. So yeah, we can't switch anyone to interest bearing loans.
In regards to medication, does the program fee include medication?
So with some of our egg donation programs, it does include medication, but all of our standard programs do not include the cost of medication. So medication does vary quite a lot, depending on which protocol you're recommended. So that would need to be paid directly to the clinic. If you do want to kind of roughly work out the costs of a cycle and medication and things like that, we do have a cost calculator on our website, so you can get an idea of what that might look like. But yeah, unfortunately, the medication does need to be paid directly to the clinic.
Okay. Um, we've already covered this. I just will read it out. If we've had a live birth on our first cycle, will we get the excess back that we've paid?
Yeah, so unfortunately not. Basically, if you have a success anywhere in the program, if you have a baby, that is the end of the program. So I guess just to say again, it's I guess the slight risk or um, the slight risk element of the program is if you do have a baby early on, you may have paid slightly more than you will have paid the clinic directly for a single cycle, for example.
But it's the reassurance you get, isn't it? And the assurance of knowing that you're going into a treatment, not having to
Yeah,
worry about where the next bit might come from if you need to finance any further.
absolutely. It's the fact that you've got that backup plan, you've got the peace of mind that you don't need to think about, how we're going to fund the next cycle. You've got that plan in place ready for any cycles that you may need. Um, so yeah, you've got that plan.
And somebody asked quite a valid question. They said,
Mhm.
"We feel like there's a catch. How does Access Fertility make money? It sounds too good to be true."
So yeah, I think we've sort of covered this a little bit already. We some patients are successful, or a lot of patients are successful. We've had thousands of babies on our treatment programs now, which is great. And I've been with the company for 10 years, and it's why we do what we do. But if you do have a baby early on in the program, obviously in some cases, let's say if it was on the first cycle, you may have paid slightly more. And obviously there's no refund to the patient in that instance. So it's really I guess a balancing act. And then for some patients, they unfortunately won't be successful and they'll get the refunds. So that's kind of how it works. Where we don't refund patients if they do have a baby on the program. I will say, hand on heart, we've never had anyone call in who was, not satisfied with the program because they were successful.
Yeah. Okay. I think that's all the questions we have in the chat. I'll just double check. Okay, somebody's asked if you're unfortunate, say within the treatment you fall pregnant, what happens if you unfortunately don't make it to full term? Do you still get to stay on the program or would you need to reapply and pay?
Yeah, very good question. So we only count success as a live birth. So if you do achieve pregnancy, but unfortunately later on you do miscarry, then absolutely you can continue in the program. And we understand, in these instances you may need time before starting treatment again, and of course you can absolutely do that. And then you can come back on the program whenever you're ready. So, we haven't created these programs for patients to just achieve pregnancy. We want to help patients achieve their dream of a family. And that's why we've created the programs with a live birth as being success.
Okay. Do you have to, in regards to payment, do you have to pay upfront for all cycles or pay per individual cycle?
So you do have to pay for the full package up front. And then you'd either pay for that full package, so covering, let's say, 2 or 3 cycles up front. That's either a payment by bank transfer, or the other option is you can pay for that program monthly, but it would need to be the full program cost. It's not per cycle. If you were paying kind of per cycle, that would be just paying the clinic directly for each cycle.
So to pay for an Access Fertility package then, does it work out slightly cheaper than paying the clinic direct, but obviously you're paying for the however many cycles up front?
Yeah, absolutely. So you'd pay more than the cost of one cycle up front, but it would be discounted over a number of cycles. So as an example, with let's say a 2 cycle multi-cycle, it would be a bit like buy one cycle and get one discounted. It's not exactly like that, but it's kind of
I
the
know what you
easiest
mean.
way
Yeah.
to describe it. So you're not paying for 2 cycles up front. You're kind of paying for like 2 and a bit or 2.5 up front. And then you're also getting the frozen transfers included in that. And it's really kind of key to remember that if you are a patient that's been advised you may get a number of frozen transfers, the cost of those can really add up. So it's a real benefit to have those included to give yourself those additional chances to have a baby.
Yeah. Just have a look, just double check. And in terms of finding out sort of costs for the different packages, I assume it's clinic dependent on where you go and your perhaps your age, and obviously with a refund package, there's some factors in there. But so is it best to choose where you'd like to go for treatment first, or to come to you and see which clinics you offer it at?
Yeah, absolutely. So the easiest way is we have a postcode search on our website. So if you pop in your postcode, it'll give you the closest clinics to you. And then you can call up about the closest one, or you can call up about the 4 different options available to you. You may have already chosen one, which is just the closest one to you, but our pricing is individual. So each clinic is priced completely individually. So it will be different pricing for each clinic. So the best thing to do is have a little look on the postcode search, find where you might be interested. You can also speak to our team and they can advise. But then if you then get in contact, either by phone or email, our details are on the slide now. And then our team can provide you with the individual pricing leaflets. And then each leaflet is broken down into the different programs available to different age categories. So you'll basically be able to look on there, see exactly what's available to you. And then if you haven't already spoken to a clinic, we'd then advise that you get in contact with the clinic, have your initial consultation, start the process. Or if you have already had that, we can start the application once you've decided which program you'd like to apply for.
Okay. And then we've got another question. What happens if you start an IVF cycle and it's abandoned or cancelled? Who
Yeah,
pays for
so
that cycle, and are you able to try again?
yes, absolutely. So we include one cancelled cycle per program. So what that means is if you have one cancellation, the cost would be covered and you wouldn't need to pay anything additional and you could just start that cycle again. That doesn't mean that if you have more than one, you can't start again. Absolutely not. What it means is if you do have more than one, we just ask you to pay the cancellation fee directly to us. And that's typically around £400 or £500. And then that basically allows you to reinstate that cycle. So start that cycle again whenever you're ready. And again, we don't put any time pressures on you starting that cycle again. Just whenever you're ready, you can go ahead.
And if there's a subsequent cancelled cycle, is there any fees to pay?
Sorry, so the first one's included, so there's no cost. If you have 2 or more, that's when you'd pay us the cancellation fee, and they range from around 450 to I think max around £600, depending on your clinic. Again, it's individualized to the clinic, so you'd pay that to us, and then it does allow you to start that cycle again. So if you had 2, the second one, sorry, you'd pay that. If you had a third one, you'd pay that
Yeah.
directly to us to start that cycle again. But yeah,
I
the
assume,
first one is free of
yeah.
charge.
But as soon
Yeah.
as you've had egg collection, that counts as one cycle, doesn't it?
Yes, absolutely. So kind of the main costs are like incurred for an IVF cycle because you are going to the theatre, you've had all the workup and everything, they're kind of incurred at the egg collection stage. So that would count as a full cycle.
And then linked to that then is if you decide you've taken out a multi-cycle program, whether it's refund or a multi-cycle, and you
Mhm.
decide, say you took out a package for 3 cycles, but you've done 2 or 1 or 2 cycles, but you've decided you want to exit the program, what happens in that scenario?
Yeah, so we absolutely understand there's a number of different reasons why patients may not want to go ahead with any further treatment. So we like to be as flexible as possible, and we'd always give patients the option to withdraw. So what we'd recommend in the situation is you give us a call, and then we'd basically work out if there was any refund due. If, let's say, for example, you've only done the one fresh cycle, then the likelihood is we would be able to give you some money back. If, let's say, for example, unfortunately, you have been through a number of fresh and a number of frozen, it may be that the cost of treatment is kind of more than the program fee, but we'll always, if there is any refund due, we'd always give it back to you. And also, let's say, for example, in some cases, you may have been going ahead with own egg treatment, but unfortunately now the clinic has recommended that you consider donor egg. We can also look at options for you moving on to a donor egg program as well.
Okay, thank you. It's just one more. So he wants to just clarified that. Just want to clarify, do you have to pay upfront for the full multi-cycle package in its entirety before 45?
So yes, basically, as long as you pay, even the day before you're 45, as long as you are 44 when you pay, you do have to pay the full program up front. However, if you are taking out the finance, provided you have the finance in place, we don't expect you to pay that 12 months off before you're 45. So you have to be enrolled on the program. And when we say enrolled, that's either you've paid in full or you are on a finance plan. So you're starting to pay off that program cost.
I say, because there must be some paperwork and things to sign to enroll up. Is that all quite
Yeah,
easy?
it's a very standard finance application. So you'd need to sign a loan agreement with us. So to basically for that loan over the 12 months, and it's obviously linked to the program, but that's a separate loan agreement, the same as any loan agreement you take out. Let's say, I don't know, if you're taking a loan out for the sofa or whatever, it's it's still a standard loan agreement that you'd need to sign with us. And then we'd authorize the treatment with the clinic as soon as that loan agreement was in place.
Okay. And once you've enrolled, is there, like with lots of things, there's like a cooling off period if you've changed your mind, not even had any treatment? Um,
Yeah. Yeah, so there's a standard cooling off period of 14 days. So, of course, you can withdraw at absolutely no penalty if you decide not to go ahead. As I said, with the loan, you can repay that at any point with no penalty. And then if you did decide to withdraw and it was outside of the 14-day cooling off period and you'd had no treatment, the only thing we'd deduct from the refund would be a small admin fee of £150, but we would return the rest of the program fee to you. Obviously, if you've taken out a loan and you'd started to make payments, we'd also work that out and repay any money that was due to you from those repayments as well.
okay. Somebody said here they've used Access Fertility before. They were unsuccessful, but they'd say that the team at Access Fertility were absolutely amazing and it um, helped manage. I would recommend them. We're currently exploring treatment abroad. So
Oh,
that's a
amazing.
lovely bit of
Thank you very
feedback.
much.
Thank you.
Thank you. That's very nice.
So yeah. Okay. If I stop recording and then we can ask anybody else if they want to actually ask any questions. But thank you, Olivia. That's been really helpful. We've covered quite a lot there.